Sudhir,
Yeah.
just stop sharing your slide. We can see it now.
Okay.
Check.
Yeah.
Uttam sir, can you mute all, please? Someone is unmute and there's a lot of background noise.
Hello.
Yeah, am I audible?
Yeah, you are audible.
Yeah. So, good evening, everyone, and I welcome you all on behalf of SSPP, Society for Study of Pain, Pune. So, this is the webinar we are conducting every month as a part of our academic activities. Since the COVID times, we started with online webinars, which happen every Monday, last Monday of every month. And today we have esteemed speakers to deliver a topic, and I can make out with the attendance what the enormous response we have with this attendance and participants with us. And still we have participants joining. But as we have said, we are about to start. It's already 8 o'clock. And I welcome you all. And now I'll hand it over to our president, Dr. Joyshankar Jana. Yes, sir.
Yeah, very good evening to you all. On behalf of Society of Study of Pain, Pune, I welcome you all honorable members from Mumbai, and honorable members from across India and abroad who are joining in today for this scientific clinical meeting. And today we have excellent two guest speakers for whom they are the pioneers in pain, and they have been teaching pain since long, and they are promoting an awareness of pain. Dr. Kailash Kothari and Dr. Sudhir Dara. And we are really proud that not only you are spreading the awareness of pain, but also conducting clinics where you can teach pain to the new pain consultants. Though here in Pune, we also have two institutes, Bharati Vidyapith and Sasun Hospitals, who teach pain, but we have also the young generation who is also interested in teaching pain. I think so. The first pain clinic, a fellow from Dr. Varsha, who has already passed out now. Congratulations, Varsha. And the next is the Dr. Kashinath Bangar and Nivedita Page, who has also started a program for teaching the young pain consultants coming across from a state and across India. So it's really a great honor that we are spreading the awareness of pain. And of course, the topic today is that Kailash is going to speak about from pain clinic to the pain hospital. That's a fantastic topic. It's a dream for everybody. Just like that, I still remember when we were getting into post-graduation, the skin dermatology, there used to be a department only for OPD. Now they have skin hospitals. So it's a fantastic concept that from pain clinics to pain hospital. And of course, Sudhir, good old friend, using the social media as a marketing. Of course, Sudhir must have gone from national to international, having many centers all over the India and world. So spreading the awareness of pain. And Dr. Uttam is our coordinator for today. Of course, he's going to introduce you formally to both the speakers. And I welcome all. Please enjoy this session. Give all your comments and feedbacks on the chat box so we can have a fantastic discussion after the two great lectures. Over to you, Uttam.
Thank you, Dr. Joy. Thank you, Dr. Varsha. On the behalf of SSPP as well as Department of Pain Management in our Mangeshkar Hospital, I welcome you all. Today we have some eminent people among us who have done some pioneering work in the field of pain management. We have some different and unique topic about which no one discuss or talk much, but those are important.
Recording in progress.
When you are starting your practice. We have with us Dr. Kailash Kothari, first He is going to deliver his lecture. Both of them need not have any. They don't need any introduction, but that is a formality I have to do. So I will introduce Dr. Kailash here. He is a immediate past president ISSP. You all know he's a past editor in chief, chairman of MISS and Endospine Society for Endoscopic Spine and Interventional Pain Management. He is attached to various hospitals in Mumbai, that is KM Hospital, Jagjeevan Ram Hospital, Fortis Global, and Apollo. He has published many articles in the national and international journals of pain and orthopedic. Director of Fellowship in Pain Management, organized many conferences, workshops, and he has been invited at national as well as international levels as a speaker and for various workshops. I think he is one of the first pain consultant who started a chain of pain clinics under the banner of Pain Clinic of India in various cities, including Mumbai and Goa. So he's going to talk about a journey of pain clinic to pain hospital, whether it's a dream or it's a reality. So over to you, Kailash.
Thank you, Uttam.
So you can start sharing your screen.
Yeah. Can you see?
Yes, we can see.
Visible.
Okay, thank you all the organizers, especially Dr. Joy, Dr. Uttam, Dr. Varsha, and entire team Pune. I'm really thankful for getting invitation from your side, and the topic is also very, very interesting. I think everyone who is starting his practice in any field, they want to have their own setup, and if it is hospital, nothing like it. So basically, the first thing is when you are starting your pain clinic, you are thinking something big, but always on the back of the mind, we think if pain hospital is a reality. So we are just discussing how we can make this possible. So whenever you are starting anything, you have to make sure that you know the intricacies of your business. Don't consider the any of the practice which you are starting and you are investing in as a simple practice. You have to think as a business itself, and you have to know the market. So what is the market? That is your consumers. In our case, they are patients. They are patients. They are the different kind of societies we are surrounded by, and in our country, what is the trend? What people want? That market we should know. And everybody must be watching Shark Tank. What is Shark Tank? Shark Tank is where new ideas people bring, and the sharks, they listen, and then they think whether it is an investable business or not an investable business. So you have to make sure that whatever you are thinking, whatever you are planning, it has to be investable and it has to be profitable. If it is not profitable, then you are not going to last long. So know intricacies about your business, and you have to know your market. So you have to research, you have to use the technology, you have to use various teams of your surgeons and various other treatments what you are going to give to the patient, including rehabilitation and other there, so that your patient care is very good. And you have to bring all the expertise to your team, so that you can give a very good bunch of team to the patients who are coming to you. So this is one of the opening statement in an editorial penned by Henry McCoy, who is a professor of anesthesia in Oxford University. It has come in a journal which says chronic pain is common, but it isn't sexy. That means people are suffering and suffering and suffering, and it doesn't mean that people who are suffering, who are seen normal from outside, but they are suffering from inside, and it is not good for them, for their productivity, for their family relation, psychological, everything is affected. So when you are thinking that whether should whether I should go for hospital. So investing in hospital in today's world, it is not a simple thing. It is not a simple thing. Like you're not only investing in your land, you are renting the land, or you are you are employing many staff who are going to run your show, marketing people, HR people, people who are managing your nursing, your OR, your rehabilitation, everything. So for that, you should know from where your patients are going to come, from where your income is going to come. For that, you should know what is the burden of this pain, chronic pain. So you should know what is the data. So data is very strong thing. When you know the data, you are confident about getting the patients or your consumers to your business. So burden of chronic pain, you should know on your mouth, on your tongue, you should know by heart. So if you see, you should, if anybody asks who is not a from your pain specialty, they will ask what is the burden of pain management. Then you should tell that patient chronic pain is almost 30% of the population is affected, and it has gone up to 80% in some of the articles. So there are many articles which says that chronic pain is so much common that each and every person in their lifestyle suffer from some or other chronic pain. Now, it is considered as a disease. That is another thing which goes in favor of starting something which is specially treating that disease. So chronic pain is a disease, and you need hospitals to treat the disease. So patients are active despite of pain, or patient have a lot of psychological issues. The pain acceptance and optimization is a goal of the your goal of your team. So you need to have multimodal treatment, and that for that multimodal treatment, you have to have multimodal team. And there is enormous cost which society has to bear as a result of burden of chronic pain and suffering. When society is bearing the cost, okay, they are spending so much on the treatment and investigations. There is someone who is giving these services, and they are charging to these patients, and they are earning out of it. So who are they? They are the service provider. And who are service provider? They are the hospitals and doctors. So whatever expenditure society is doing over the pain, the direct gain is to the doctor and the hospital. So we must know these figures very well. In other lectures where we talk about back pain, neck pain, and treatment modalities, it is not that important. We think, okay, that this epidemiology data and this cost data is not important. Maybe to learn the technique, it is not important. But when you're going for a business, when you are expanding your business, when you want a clinic chain, or when you want hospitals to be built on a specific disease, you should know everything about that disease. So you should know that most of the patients have not received pain specialist treatment, and 40% reported inadequate management of their pain. And that gives a very strong positive data that a pain hospital will cater to these unprivileged patients who have not received proper treatment, and pain specialists who are very well trained, and they can cater to various types of pain patients, give newer and better treatments which are non-surgical, can be of very good help to the people. And that is what give you confidence that yes, when I invest, I'm going to get a good return out of it. So when you start your business, you want everything to give good return. So India don't have much data, but if you see the data, simple things like absence from the chronic pain, 7.37 billion in Sweden. USA, common chronic pain, only absenteeism costs 61 billion of expenditure. And Annual economic cost associated with sickness, absence, and worklessness amount to over 100 billion world over. So this is huge data. There's no other disease which causes so much of expenditure, so much of disturbance in work-life balance and psychological balance. So pain hospital, can it be reality? This data shows yes, it can be reality. And patients with chronic pain who are managed poorly will bounce around the healthcare system, becoming more and more separated and consuming considerable resources. And those resources, if you combine and bring under one roof, that is pain hospital, you are ultimate winner. Okay, so these data are very important as far as what is going to be income. So if you see the health expenditure per patient on and on the healthcare system, so huge per patient. Canada, it is $2,000 to $4,000 Canadian dollars. Germany only back pain is 13.44 billion each year. That is why these countries, they have huge departments of pain clinics and pain department, and whooping 1 billion for NHS for back pain only. So these are all why I'm showing, because in India it is same, and we have number of patients who are paying from their own pocket. They may not be paying you in dollar, but at the same time we have huge population. The number is huge. If we cater well and we use what Sudhir is going to teach us in next lecture, how to make sure that your facilities are being properly conveyed to all the population which is lying around you. These are the chronic pain patients who can take advantage of that, come to your hospital and take treatment, and hospital become viable. Viability is very important. If you see almost startups, if you see 80% of the startups, they fail because they don't have good plan. Even if they have good plan, they cannot execute it. Even if they execute well, they cannot manage it. So what you need is a complete chain of system which works well, and you should be master of it. So these are all data. So there's an enormous data which support the view that of need of specialized pain management center with multimodal treatment options for effective and lasting pain relief. So multimodal is important here because in pain clinic, we as a single specialty with or without physiotherapy can survive because expenditure are not much. We are running and treating in one way. But when it comes to hospital, you should have various departments which should be catering to different needs of the patient, and patient should get everything under one roof. So opportunities as far as pain hospital is concerned, it is staring at you. Okay, so you should answer this following question: why I should start pain hospital? Huge population. That's our biggest advantage. Big proportion is suffering. We know from the data. Need is real. It is not that some other specialists like maybe physician or orthopedics or neurology can manage these patients. If they are able to manage, then why these 40% of patients who are there with chronic pain, they are not managed well? Why? So why? It is very important. Then plan. When you think that the need is real and you can have a good opportunity when you start your own hospital, you have to have understanding of proper business and what is plan, what is the project plan, where you are going to start it, what are the facilities you are going to give it, and what team you have. Ultimately, it boils down to the team of specialists, team of staff, right from nursing staff, rehabilitation to your grade C workers. Everybody has to be trained well so that everybody can give a good service to patient, and ultimately your hospital become very popular among patients who are suffering in pain, and there should be mouth-to-mouth publicity. So plan well, and again, you have to have eagle eye view. You have to have business mindset. think big. It is not only one hospital. It is not only one clinic. You never know. If you go through the history of pain management or other specialties in US or in other countries, European countries, there are bigger players who are looking for good management, who are looking for good doctors, who are looking for good hospitals, good clinics, and they want to join with them. They want to expand. There are a lot of inquiries which keeps coming, and they want to invest in the business of pain management in other healthcare system. So you can have these opportunities. You can expand really very fast with the help of these people. You have to come together. You may collaborate with your colleagues. You may create a system where chain of clinics are there, like Dr. Sudhir is there, Dr. Das is there, Dr. Dureja is there. So everybody, Dr. Surange is there. So everybody is thinking big, but there's a lot of hard work, there's a lot of learning. You have to make sure that you know each and every aspect of your business well. You can go for expansion over time. You can really grow big with various ideas you have around you. So learn and grow. So understand the scope, where you have to set your goal, where you want to reach after 5 years, where you want to reach after 8 years. So for that, you have to learn, because medicine is ever evolving science, and pain management is no exception. You cannot say I do root blocks and other things, sonographic block, I am okay. There are a lot of new things are coming. There's regenerative medicine, there's endoscopy, there is gene therapy, there are a lot of things, there are Botox, aesthetics, so many things are coming. Once you have a hospital, you have facility to give services for these facilities to each and every patient, whoever required. So you should grab the opportunity when you see it. You should not wait for others to start and then you start. There's no point, because if you start first, you have advantage. And you have to understand that you are making a lot of difference in healthcare world. When pain management was not there, we all know what was the situation. There were patients who were roaming around without any relief. I can say that because when I started, there was no one able to give a good service to patient. Even when I started, I was not trained enough to give this kind of services what I am giving today, because learning happened over time. When I taught to many people, I also learned. That is very important. So make sure that you understand that you are unique. Each and every pain consultant who is learning pain, they are unique. There are very few like you in your area, in your city. You have to keep ahead of the curve and make sure that you don't lose the advantage of being unique. You have to keep learning and learn the latest technology. That is very important. And as I told you, that you have to take first mover advantage by introducing newer thing. You have to invest in newer technology. You have to understand that most of the interventional technique we are using, they are well tested. They are over last 30, 40 years, 50 years. People are using in various countries. And right now, with our experience, maybe we have very big number of treatment patients load. We are treating them with these many treatment. So technologically, we are at par with everyone. So make sure that you understand that you are not inferior to anyone. Okay, so we have to make sure that we also market ourselves as a best non-surgical option for the patients who are suffering in chronic pain. And that's the key. We all know that's the key. So never deviate from this key statement. And authentic. You have to give your practice authenticity. How you can give authenticity? You have to get trained well. Once you get trained well, it will give authenticity to your practice automatically. People will know how you are practicing, what are the things you can manage, and you can earn respect from the colleagues. And that is how your referral system will work. I hear from many people that they sit and they say, nobody refers me. They never support me. I think myself, why I have many people who are re- referring me. They are believing in me. There are many patients who are referring me, and most of the people who are practicing over time, and they are genuine practitioners. They learned their pain management hard way. They will agree to my this statement that if you are worth of it, people will definitely come to you and they will support you. They will send patients to you. If you are not worth, they will not send. You cannot blame others for your failure. So you make sure that you own it. Whatever failures, you own it and then learn how to overcome these failures. So this is one chart. Okay, how much the pain management is growing. If you see this from in 2020, it was just 2.8 billions, and there's a growth of almost 8.9% per annum. And over next 10 years, it is supposed to be almost 9 to 10% per year. This equipment market is going to grow. So who are using this equipment? Pain physicians. If pain physicians are using these equipments, it is not only the equipment companies they are going to grow. It is the pain physician who is going to grow. If they grow, companies will grow. So be a visionary. Understand the growth of the specialty. It is growing at very fast rate. If you get trained into all new technologies, you understand which works, which doesn't work, and follow your instinct, you will be very, very happy, very, very successful, and your hospital will be very, very successful. So be a visionary. That is very important. So these are some of the hospitals. USA. The picture is taken from there. If you see Indian data, it is said that pain management, post-operative, and geriatric care. Most of the geriatric care, they are old people. They have arthritis. They have back pain. They have a lot of other issues where you need pain physicians. It is likely to double to 35 billion by FY28. That's a Redshift consultant, and currently the value is 17 billion. The business value is 17 billion. So pain hospital can be reality if you have mindset and understanding the healthcare business. That is very important. You cannot just, I have a land and I can start the pain hospital. Then you will have an ordinary hospital. If you have understanding of your market, understand what facilities you are going to give, and have faith in your data, then you can be very, very successful. So business model should be good. There is an opportunity for success. So research and plan, it is very essential. Execute what you plan and don't deviate from your aim. It cannot happen that you make a 5-year plan and whatever you have planned for, whatever goals you have, every 6 months you change that goal. You cannot do that. And give your 100%, work very hard. Have to have a good team. If you have a hospital, depending upon the size of the hospital, whether it is 5,000 square foot, 10,000, 50,000 or 1 lakh square foot, that you have to manage how big the team you need to make sure that hospital remains busy and you have a various kind of patients who are treated under your umbrella. So multimodal team is important. Use all specialties for growth of your business. You never think that in my hospital, I'll not do any surgery. Okay, if your hospital aim is that you will not do any surgery, make sure the surgical patients, they are referred to a right doctor which is part of your team. Even if you are referring to other hospitals, he should be in your circuit. He should not go out of the circuit. So patient should get everything under your circuit, in your circuit. So your physician, your rehabilitation specialist, everybody should be around. Respect your team member. You cannot say that I am better than the other one. everybody, make sure that you take a member in the team who is well qualified and who gives his 100% to your team. Then only you can respect each other. And ego is very harmful. When you are in business, you have to be very, very diplomatic. You have to make sure that everybody is happy, right from your CEO to your very smallest employee of your team. And management should be crisp. You have to assess the plan and its success and make changes whenever it's required. And whenever there are failures, if something is not working, suppose you are working on marketing, it is not working, you are not getting number of patients what you have planned, you have to make sure you change in time. You cannot keep dragging that same plan again and again and keep failing in that. That will take toll on that will be too costly for you. Take help of quality employees. You can have various employees who can help you, right from CEO, business management, HR, and marketing people. And encourage your team with promotions, incentive, and ESOP. ESOP is employee stock options. So you can give some shares of your company to him, and they will be happy because if company grows, their net worth grows. So last slide, important characteristic for successful pain hospital is you make sure that your demographic and market opportunity is proper. If you are making a proper size hospital, at least the population which is you are covering is 30,000 to 1 lakh should be there. Pain hospital advantage, patient gets all services under one roof. Unique model, you have to create a unique model to market. Location should be strategic, convenience and ease of access. Insurance coverage, all the patients should get insurance coverage, because right now we see that most of the patients who are coming, they have a lot of insurance and private or maybe government. So you should have insurance coverage. Comprehensive scope of services to optimize the reimbursement. Then well-trained, strongly motivated physicians are very key. And it has to be led by pain medicine trained anesthesiologists. And make sure that person who is leading, he's well trained, he's keeping himself ahead of the curve, and he should have entrepreneurial attitude, a strong work ethic, and financial incentive. Good training is a key to success, and good incentive-based program helps maintaining the team spirit. Focused marketing, which Sudhir is going to tell us, that you have to use two-pronged marketing approach. One is target the patient and target the referring physician. You cannot ignore any one of it. Efficiency and optimize the practice plan. That means depending upon the workload, you should have enough room for your patient for waiting, for examination. And so patient experience should be good in your hospital. Once they come, they should go with happy memories. Effective billing and collections. And you should always have 5-year projection, and you should follow up this project plan. Know the source of your income. From what are the sources from you are going to get income? What are the expenditure involved in that? Each and every expenditure should be noted, and it should be you should make sure that where you can cut down the cost. That is the cost which is cut, it is earned. Know your taxation, depreciation. All these things they come under business management. So know what are loans you are taking, what is repayment schedule. Your credit should be good. Know your legal accounting liabilities. Know your staff expenses, ESOP. Promote the most profitable section of practice. Suppose you have a practice like Sudhir. He talks to me and he says my regenerative medicine is working well. So he's focusing on that. He's trying to get most number of patients who are interested in regenerative. So you focus on area where your clinic is famous for. You optimize the number of patients who you are getting for that treatment, and know your staff expenses, and plan good marketing and plan budget. Analyze at regular time interval. Future. This is very important. Once you start any hospital or small thing, you can have opportunity to go faster by collaborating with different other hospitals or clinics. You can merge other clinics in your practice. You can monetize that practice, or you can sell your practice to other hospitals who are interested in buying you. So you can make multiple of your whatever you are earning today. And there are bigger plans which you should think of, because there are few competitors at this moment. You can multiply acquisition, venture capitalist, angel investor, fundraising, and IPO. You can have a public company in future. So you have to think big. And I think hospital for every pain physician is a dream. And if they work on the dream, they work on business plan, it is very much achievable. And you should have timeline. So you should make a blueprint and make sure that what you are going to achieve at what interval. And if you don't achieve, make sure find out the reason why you are not achieved it, because success lies in planning. So you can do it. That's the message. Thank you very much.
Thank you, Kailash, for your excellent presentation. We wanted to hear all these things from you, as you are experienced in that. So we will move on because of the short of time. We will move to our next speaker, Dr. Sudhir Dara. Hello.
Yeah, I'm here.
Yeah. So I know Sudhir since long, because he was attached with Traveling Pain School, and I did one workshop of Traveling Pain School in Pune, in Deenanath Mangeshkar Hospital. So we are fortunate to have him here. Sudhir is attached to various hospitals in Hyderabad, that is Care Hospital, Sunshine Hospital. He is a past GC member in ISSP, Honorable Secretary in ISSP Telangana State Branch, hold India book records for maximum work in regenerative, and I keep on listening about how many cases he did in a day and all that things. So he's a big man now, and starting his another branch in maybe in UAE, I guess, Dubai. Yeah. And he has got a lot of one in Hyderabad, one in Chennai, and he's a dear friend. So I introduce Sudhir Dara here, and over to you, Sudhir.
Yeah, thank you, Uttam. Thanks all the organizers of Pune SSP for giving me this opportunity. So the previous speaker, my good friend, Dr. Kailash, has told you in the whole of the talk, what we understand is there's a huge money is waiting for us to earn in pain medicine. Because when we look at the healthcare profits in any setup, if the profit is around 15 to 20%, that means that particular hospital or that particular clinic is doing excellently well. So all the venture capitalists, all the people who are having thousands of lakhs of rupees, thousands of crores of rupees, they want to invest in such type of profit where the profit is around 15 to 20% in any healthcare. But as a matter of fact, pain medicine has got a profitability up to 50 to 70%, because you all know how much will be the cost of an intervention. So basically the profit range is around 50 to 70. So that means there is a lot of revenue to be tapped by pain specialists, because the burden is so much, as rightly told by Dr. Kailash, so much in the society, and so many people are waiting for these non-surgical therapies, because all the people are vexed with the surgical therapies. There are lots of complications, lots of surgeons coming out, the juniors operating on different parts of the body, and the complication rate is slowly growing up because of the surgical thing. So the public need is people are waiting for the non-surgical therapies. So let us understand how to market our own practice, how to market our own the skill, the special skill of doing a pain management, of not sending the patient for any surgery. So the disclaimer is all the presentation what I have done is only my own experience of starting my own clinic Epion with a zero revenue to what we are today. So in Hyderabad, I and Dr. Meenal has set up this in 2018. Now 5 years after, we're doing good, and a lot of progression is there, going for bigger centers and multiple centers. A lot of funding people, investors are ready to join with us. So this is I'm not taking anything from the internet, books or research guidelines. So one more very important point which I need to tell you is this talk is useful for only those pain physicians who desire to earn more money, unlimited money in this specialty, because in this marketing, whatever you want to do, you need money. So you need to invest money and you need to get more money. So those people who can afford to, put some money into the market, they're the best people. And once you start earning money in this pain specialty, you'll never go back. So this looks a bit, commercial, but this is the thing what we do when we do practice in a bigger way. So marketing in any healthcare is a process of exploring, creating, and delivering value to meet the needs of target market. In terms of services, we don't have goods. In terms of potentially, including the selection of targeted. So whatever you do, you connect to your audience at right place at right time. So the days have gone where people look for a doctor who is very famous. No, now people are looking for a doctor who is famous in the market. So whoever is visibly seen in the market, whoever is like, this guy is there in all the visible modules of people searching for the help for any healthcare. So you need to be famous in the market by your visibility to all the needy people. So that is marketing. So what are the essentials of good marketing? Understand the product. Our product is giving non-surgical pain management. So if you understand what you are doing and if you understand what the people are looking for, is it really necessary in the society? So you need to understand that particular area into consideration. Like you are opening something in Pune. So what is that need of non-surgical pain management therapy need in the public? That analysis you should do. And one more very important thing is how different is your skill. Like any orthopedician, if he wants to start his clinic or hospital and starts marketing, he doesn't have any special things. Everyone does knee replacement surgery. Everyone does arthroscopic surgery. But if you want to say that I do knee replacement surgery or arthroscopic surgery better way, no one will have any interest in that. So in a lot of medical specialities, the skills are almost like equal for everyone. So but in pain specialty, your skill can be marketed saying that my pain management treatment is a non-surgical therapy, which can be a very beautiful alternative to any surgical procedure. So that is essential of a marketing for the pain management to be done. Population target. So where we have to target, like the chronic pain is generally it's after 40 years. No, you don't target your marketing to teenagers, to college going students or youngsters, very youngster. So those people who are having more than 40. So that's where your target should be. It should be more than 40 and above. So public demand. So if you understand the public demand, if for example for any chronic degenerative condition, so most of the times till almost like recently 5 years, everything is by surgery. Everything is by surgery. Whether you take for the knee joint, whether you take for the spine, whether you take for the shoulder joint. But when you ask few people whether you want to get this procedure done by surgery, 99% of the people, they don't say no. That means people are waiting for something which is devoid of surgery. So there is a huge demand in the public to embrace this specialty, and you should have a fine discretion of how to reach the people. What are all the ways where these people having chronic pain are searching? So is it a newspaper? Is it a TV? Is it a Facebook? Is it an internet? Is it a Google, or is it a Instagram or LinkedIn? So you need to understand in your area, wherever you put a practice, how to reach is more important. So before that, if you want to start a practice, or you want to market, or you want to put some money into the market, you should have a belief that you have to have a belief to say to the patient that we can manage your pain without surgery. If someone is starting a pain clinic and you have a belief more on the surgery, it won't work. You have to have the belief that I can treat this patient. I can keep this patient with me for a longer time without surgery. If it is inevitable only, we will send the patient for surgery. So if you have the belief that no, we can treat that particular patient without any surgery, and we can manage the pain, and accordingly you counsel the patient, then your marketing is going to hit you like anything. So that is the most important thing. You have to have a sensible marketing. Sensible marketing is like balance your spend and earn. So you put 1 rupee in the market, you must be getting 5 rupees out of it. If you don't get a 1 rupee, even though it's a waste of money. So you need to balance the spend, what you do, and what you earn. So that is a very, very important thing, and in the planning of the marketing. So have a budget for marketing. So you built up your clinic with the 50 to 60 lakhs with all the equipment and the place and the rental and interiors and all. But you have to have a budget for at least 6 months to start the show and start getting the patients, and you need to be visible to the patients who are needy, and your clinic should be visible to the patient. Till that time, you need to have some budget according to the market, what you want to do. So types of marketings and lots are there. But only thing is you have to slowly, strategically, you want to put money into the market. I'll come to those points. The first point in marketing is your place of work. Place of work is a big marketing for anyone. So if you put your clinic somewhere where there is no visibility, so that doesn't work. And the name of the work also, app name should be there. So that app name and also app logo. This is very, very important to people understand. See, a lot of pain clinics, they get misunderstood with the Ayurvedic and homeopathy and also physiotherapy. So you need to put a classy name with a proper logo that this is the allopathic discipline, and also this goes on when you have multiple centers, and also people will know that there is something has come up in allopathy where we need not go for surgery. And launch of the clinic also should be very visible with some VIP. And when you launch a clinic, a lot of doctors should know that you'll be doing this job, and those doctors might favorably or potentially can send some patients to you. Generally, it is not the case, as Dr. Kailash is telling. Don't depend on the doctors to send cases, but doctors will send cases over a period of time. Initially, no one wants to share their patients to us. They want to do something else, or they want to keep the patient with us. But launch of the clinic and familiarity among the doctors should be there, so that some percentage of doctors who are really interested in pain management, they'll send case. And next thing is the digital marketing. Digital marketing is nothing but so everyone is having cell phones, smartphones, where they will search for their chronic pain ailments for Google, for internet, and the Facebook and all. So digital marketing is very, very highly potential kind of marketing, very vital marketing module where you get immediate patients. So newspapers, even though newspapers are the mainstay of the traditional kind of marketing, they're expensive, but at some stage you should start doing the newspaper also. And the TV shows is very, very important, because all the common man likes to see how a doctor talks. So doctor is a noble profession where they would like to see how doctor talks, for the questions given by the patients, and also they would love to see how we talk. So a live program or a recorded program in TV shows is also very, very important. In later parts, the hoardings, these are expensive. These come in the later part of the strategy. Lollipops are nothing but the screens which are put on the medians of the traffic. Traffic umbrellas are where the traffic constables stands and changes the signals. Those are the other things. And finally, when you start earning good amount of revenue, sponsorship to the events like music, launches, and also film launches, and events like marathon runs, and a lot of things will be there, which create a good branding for you to make your practice more viable. Achievements as a news article, you get some award in IMA. So that news article, you try to talk to the news people and put it as a news article, not an advertisement. So that gives more credibility to your practice, more credibility to your clinic, and also yourself. Finally, philanthropy, where you do a charity. Charity is also creates a lot of goodness in you and in your clinic. So that these are all the types of marketings which are available right now. The traditional marketing, which generally is followed for big like soaps or shampoos, they're big multinational companies. They use newspapers, they put it in magazines, they do use these screens in the cities and also the standees. But this can be done. This can be done not in the initial stages, but when you start getting revenue, you will have an idea that I should put it in newspapers also. The basic disadvantage of the traditional marketing is they're very expensive. So initially, don't try to jump into these things because they involve a lot of money. So other classification of different types of marketing is marketing for immediate response. So you have your working capital for 6 months, but what you need is to for the survival of the center, for the survival of you need to see what are all the marketing strategies for immediate response. You start today marketing, tomorrow onwards, you should get some calls and some patients. And there is another marketing which is marketing for branding. Branding is for a long term. As I told you, a lot of investors are waiting for these standalone clinics to be invested, because standalone, I told you, in pain management especially, there is a huge amount of profit involved in this. Each procedure, if you do for 1 rupee, almost like 60 to 70%, 70 paisa is the profit what we can get. So this particular branding is to people will keep a watch on you, so that no immediate response will not be there, but it will be continuously kind of keeping a buzz about your clinic and about your name. So marketing for immediate response, you start your clinic and you have some capital money, and how to start. So first thing is the social media. So social media is the very valid kind of module in getting immediate response. The first one is the Facebook and also the Google, Instagram and YouTube. So LinkedIn is a kind of professional thing. So you need to concentrate on these the social media marketing. Social media marketing, you should have some idea, but you should hire someone who is good at doing social marketing, and you need to concentrate mainly on Facebook, YouTube, Twitter, and Instagram, and of course the Google. So social media, before starting the social media, everyone should have a beautiful website. So website is the one which is the face of that particular clinic, which is the face of that particular business. So in the website, very, very important content. The point is the content should be written by the doctor himself. If you are the pain specialist, all the content like different types of headaches, what is headache, how many types of headaches, a common man, what he expects from that website, those things you have to write, and you have to mention about the treatment options, how to identify. So a good content is only done by the doctor himself. If you are the owner of that pain specialty, you need to do the content. Don't give the content to any professionals. Even the professional is a doctor, they cannot fulfill the need what we want in the website. And you need to talk to the digital expert for the search engine optimization. This is nothing but if someone clicks in the Google, the best pain management center, our name should come in first. This SEO is a continuous process. You need to tell your digital expert that every day search engine optimization should be done, and I have to be in the first 3 or 4. Brand awareness, this is what I've been talking to you. So a lot of future expansion will be there when your social media continuously gives your visibility to a lot of people. People will be watching. A lot of people have got lots of money to invest in which healthcare. So healthcare is the best investment for a venture capitalist. Venture capitalists are those guys who have lakhs of crores of rupees. So they look in healthcare. But healthcare, as I told you, a lot of healthcares are around 15 to 20. Even you take Apollo or Yashoda, the profits are just around 15 to 20. They'll be seeing which specialty has got a more amount of. So for that, in social media, the brand awareness should be continuously happening. For all these things, good digital expert is needed. A smart guy, even though if he is a junior, you have to pay some money, and you sit with him and tell the importance of the pain specialty. Just that now you ask him to make a website for pain management, he will go and search in pain management, and anywhere in the world, the pain management success is not that much, because all through the world, people and also the healthcare professionals, they look into surgery only. Non-surgical, they don't give that importance. So that's why you need to sit with the digital expert and tell him though that the importance of this one and the real reach where you have to go and all, and regular meetings you have to conduct with him, so that he understands what is pain management and prepare the ads. He can prepare the live talks. As I told you, live talks on the Facebook are very, very inexpensive, very cheap. You can talk on anything like knee joint pain or spine pain. Take the answer the questions and also the charts, and try to convert them into again, call them and again tell them that you have asked this question. And always Facebook queries should be connected to the website. Whenever the patient wants to have a query or book an appointment, it has to be connected to the website. These all things the digital expert will do. Instagram is also a lot of people, they use Instagram for the entertainment, but those people who are having pains, they also look into the Instagram, and you need to tell them the Instagram also, my presence should be there. Google ads are very, very important, because in the Google ads, a problem what we have experienced is, if we put as a regenerative therapy, they are not accepting. But you have to have, you should not be mentioning about regenerative. This is what we have been facing almost five years. So, but Google ads for all the other things like spine, head and neck, and cancer pain, you can do. But this also you have to sit with the digital expert. YouTube can give an excellent response, because YouTube is the video link, video app where people will be searching for it. You give a talk, record it, and put it in the YouTube. And YouTube SEOs also the digital expert should do. Say we need to if you do a TV talk, that video should be directly linked up to the YouTube. Then that YouTube will be giving a lot of impressions and all. YouTube is also very well. LinkedIn is a professional kind of your name and your professional things will be there. In social media, at most important is the patient testimonials. You have a good patient who says that I got very good relief coming to your clinic. Take an immediate video testimonial from that patient, and also a Google review. Google review is take his mobile, open your website and review. Ask him to write the review, so that that patient's testimonials they give an excellent response for you in terms of your practice. So benefits of social media are you can reach to a large area of geographic area with the different digital channels to reach bigger, because you can reach to a larger population with a very less amount of money, unlike newspapers or TV channels. So it's very, very important. Social media can give you a lot of patience, because all the people who are searching for their help are there on the mobiles. They'll be searching over there. Even you go to in Andhra Pradesh and Telangana, you go to villages also. They don't have a physical newspaper. All the villages they see news on the mobile. So this is how the social media marketing can give you a highest reach with a very less cost. You can measure the results. Like you need to ask the digital expert to give the results every week. So how much money you have put, how much is the response from the people, and how many calls you got, and how many patients have turned as a patients to you. So every week they give a report to you, and accordingly, with your all conscious, you will try to increase your budget in putting the money into the social media. So this social media can give a personal touch, like they can directly do chatting with you, then you can respond, or your team can respond directly, which doesn't happen in live TV shows or newspapers. Other options for immediate response. These are all the things which immediately can give you patients. So that is more important. So newspaper ads, these are a bit expensive but very worthful. If you are in local language, all these things are in local language. Don't go for English or any other languages initially. So English language will fetch you very few people will be seeing. But if you are in Maharashtra, try to do it in a Marathi only. So newspaper ads are there. If you have a good amount of money, the number one paper you take and give a good kind of information about your clinic and what the What is the uniqueness of your clinic in treating the chronic pain? And always your ad should be like, no, you don't need a surgery. That is more important. People are looking for that. No, you cannot favor a surgery. You have to say that surgery is not necessary. We can treat your whatever the pain is without surgery. And TV shows are also very, very important. If you have a Marathi channels in your area, where or any other language, no, you catch hold of 2 or 3 TV channels where there is maximum viewership. So this is not as expensive as newspapers, but this can the 2 ways it will give you a good response. Immediately patients will call. You have a number over there. Immediately patients will call, and this TV show immediately gets connected to YouTube. So that in the YouTube, no, whenever you type like your clinic name, that those YouTubes will come. These are not that expensive as newspapers, but not as cheap as digital. But these are also things which can immediately give you response, and you can get the good footfall. News magazines are these things which actually we started in AP Telangana. News magazine is, if you have a paper, okay, which is very, very famous in your area, there will be a news magazine which is there in the Sundays. So only weekly once you will get that magazine. You need try to put an advertisement on that, so that what will happen is the whole week all the people know would like to, they have the access to see that. So this is another finding which we have got, and we do more ads in the news magazines. And recently an ad we have done with one of the senior actors in Telugu and Tamil, where we have put this ad in devotion channels. So devotion channels are mostly seen by the oldies, like 60s or above 50. So that will be continuously running in that home. They'll be doing their works. This particular devotion channels, they have given a huge response to us in terms of footfall into the clinics. So then the next one is after immediate marketing for the brand. This is for a future the growth of your clinic. So it's a slow process, but you need to focus on this also. So visibility among doctors, talking to the doctors about our treatment, and you need to, in IMS, you have to go, and whenever there is a chance as a faculty, you go and talk to them. Talks in the medical forums and for public forums also, and liaison with the Lions Club and Rotary clubs or any other clubs, because a lot of older age group people will be there. They'll be looking for this, and clubs they kind of spread the word like anything. You need to go regularly, because as a doctors, we don't do all these things, but we need to do now and then, and get acquainted to such type of activities. Boards, hoardings, traffic umbrellas, these are only for the branding. Immediate response you'll not get. Even the radio jingles which happen, they will give a branding, but directly patients coming, it will take some time. But once you have an immediate marketing, then afterwards you can try all these things. Sponsoring events and charity, all these things, they attract the investors. So they'll be watching you, and if you're growing slowly, getting known by people, they'll be saying this. So all these things are there, immediate and late, but there is a strategy to do that. So strategy is phase 1. In phase 1, marketing only possible if you have your own full setup. You have a small clinic and go somewhere and operate. That doesn't give you much of your marketing will not fetch you anything. Because you have your full setup, you have all the liberty to do whatever you want. So that is very, very important. One full setup is the likely thing. So what I tell you is, if you want to have a clinic, don't have a clinic. Lend some money, have a full setup of around 2,000 SFT, which will suffice, and all kind of everything. You have all the operation theatre and all the equipment. And exclusive specialty. Don't mix with any other specialty. This is the marketing. Like, your spouse is a dermatologist, don't mix your clinic with dermatology, because the focus on exclusively doing your practice will be lessened. So mixing with some other friends who is an orthopedician, don't do that. So marketing is always when you are having a uniqueness, when you have your own center, when you focus on your marketing as an exclusive specialty. Prepare a project, keep working capital, at least for 6 months now. Every month you have to keep some money for the marketing, even though you don't get anything back. So hire a digital marketing expert, start with digital marketing. You first, after setting up the clinic, digital marketing is the first thing which you need to put some money in that, and tell the digital expert what exactly you want to have as a response. So you tell him about the specialty. He should understand what is this, what is the importance of this. Just like that, he cannot open a website. Just like that, he cannot make any ads. Content should be prepared by you only. I told you, keep a watch on daily activities, how much he is spending, where he is putting the money, from where the patients are coming. If you don't know that, where the patients are coming and where your money is going waste, there is no point, putting the money over there. Sometimes you start Facebook ads, you get patients, who are very low economic, like kind of, they can't even spend 100 rupees as a, consultation fee. So that there's no point targeting that area. You have to have careful budgeting, and initial start should be like, in digital, keep at least 3 or 4 forums. You keep a buzz on that, so people will know that this I have seen in Instagram, this I have seen in Facebook, this I have seen in Google. So in phase 2, when you start getting revenue, okay, now you go to phase 2, where newspaper, highly circulated and very reputed newspaper you have to select. You don't select small newspapers where you don't get anything. So you think that keeping a small amount of money, you get small amount of patient. You will not get any patient. So keep a good amount of money, put it in a highly circulated and reputed. There should be a credible newspaper where people should like that. It should not be biased. That you can always identify and decide on your own, because you kind of you're there from that place. Give more information, not the commercial content. Don't tell them I can do treatment of your knee without surgery. That should not be the heading. You should give information like what are the causes of knee pain, what are all the other things, what the things, and finally you will, in the last paragraph, try to put what you do and what is the specialty what you do. So this is known as advertorial. It's not advertisement. It's not editorial. You pay some money, do an advertisement. It is called advertorial. So it is like advertisement with the editor. So you give information, and also there is a commercial content where you put your numbers of the clinic. The title should be very impactful. Like title, when someone sees that it should be very appealing. It should immediately have the attention of that patient. So you need to think that what title, and you keep changing the title every time. Only one title, that doesn't fetch you much. Always add your photo. People would like to see your photo in the paper, and when they come to the clinic, they'll discuss on you like, this doctor is looking different from the ad in the paper. So always they like your photo. So always add your photo. Pictorial presentation of whatever you do. You do PRP, you do a spine injection, you do trigeminal. A pictorial presentation like it is a small needle injection that is going to cure you. That's very, very important in all the newspapers or in any Facebook ads. Content should be always be careful. It should be like allopathic discipline. People should not mistaken it for any Ayurvedic or homeopathy or physiotherapy. So this is how from phase 1 to we go to phase 2. And when you do all these things, after that, you will have a vast amount of personal experience, how to go about. You will be knowing where the patients are, where you're getting fetching the patients, where your money is wasting. You'll stop that. Where you're getting patients, you put more money into that marketing, and that marketing's module. So this is basically a personal kind of experience. You try to have a marketing expert. That's a waste of money. Don't do that. Okay, you try to do on your own. Maybe after growing very big, you have a excellent returns. You're coming and you have surplus money. Then you can have a marketing head or business head. Right now, we are the business heads and we are the marketing heads. So TV live shows. These are very, 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 very good armamentarium in this marketing, because TV live shows. So people in Andhra, Telangana, 3 o'clock to 3:30 in the afternoon are the TV shows in all the TVs. So people got accustomed to see a solution for their queries in this time, 3 to 3:30. So try to speak, try to do a live shows to the patient. So patient wants to talk to you live in the phone. They're very much interested. A recorded program doesn't fetch you much patients. Do a live programs. news channel shoot of the center and procedure. Whenever you want a, you ask a news channel to come to the center and you give some interview and also shoot the procedure and put it in YouTube, put it in Facebook. That will fetch you a lot of patients because it's more realistic. So it doesn't cost much also. And boosting this news channel shoot into the Facebook and Instagram is very, very important. Writing blogs to your website will create a attraction towards the intellectual patients, like patients who are good at reading editorials and all. No? You give a story about patient, a story about your treatment. That gives a lot of the online channels of major television channels and newspapers. These are online. If you have a newspaper, they have an online also. They have a lot of subscriptions. You can do that. Just like a newspaper has come up, Way to News, which is basically online newspaper. People will be reading all those things. So response to marketing is very, very important. That means you should have a telecalling. Telecalls should be there, 1 or 2 to start with. All the calls they should receive, prompt answering, clarity in answering, and pleasing. And you should have at least, if you're spending a 1 rupee and you're getting at least 100 calls, 20%, that means 20 people should come to your clinic. So the telecalling should be so efficient. No, 100 calls they get, 20 patients should come into the clinic. This is what you need to do. Marketing at your clinic, once a patient comes to, good clean signage board information. Staff should always be talk very positive about the treatment. They should be talking 100% about positive about the treatment. But when they come to you, you will give the real picture. So we cannot say that no 100% I can cure, but staff should be talking 100% to the positive. And all the procedure it should be in operation theater, because if you do it in office or in a small room, that doesn't fetch you anything. A proper OT dress and ID bands, this is also marketing, because other patients who look at the patient know you're taking the patient into the operation theater with the OT dress and all. They feel that there is something, some special thing that they should feel that no, it's just a small injection. So photographs of the achievements should be there in the clinic. So meta marketing analysis every month about the response, meet the telecallers and talk to them. Money spent and return on investment. How much we have spent this month? How much we have got? So I told there has to be balance of the spent and earn. That is why increase the footfall every month and increase the procedures done every month. That should be there. You have to take care of that every month. There should be an increase in the footfall, increase in the procedures done, increase in the revenue. And every month you have to sit with the team and think about where to put money, where to stop. Some areas you will not get money, stop there and put the money in some other things. How to enhance the marketing budget every month. You have to increase at least 10 to 20% of your income into the marketing every month, because once you start getting, you can do that. So take home message in the marketing is an individual thinking skill. It's not, a lot of agents they'll come when you start investing money into the market. A lot of people will come, sir, this is a good opportunity to do. This is one. Listen to them, but take your own discretion. You need to have your own thing to start with, and slowly you will get all the experience to kind of know where to put money, where you should withdraw the money. The more you think about it, more you do it properly. That's why I told it should be exclusively your clinic. Don't mix up with anyone else, because you mix up with few people, you have to think about them also. But if you have own clinic, it's yours, then you will think more about it, more amount of ideas, more amount of marketing skills you'll get. You don't need any experts to guide. I already told you, marketing agencies will only make you spend money. Okay, they will not see the result. So you yourself only spend money and you see the result. They just come, they'll say that this has got a huge, response to this. But that is not that. You have to have, after doing 6 months or 1 year, you will be knowing you're the best marketing agent for your clinic. So result will be but you have to wait. The doctor is the best assessor of the marketing. So because who are the patients coming, how much you are earning and all. So this is how it goes. So these are the 2 EPON centers in India, Hyderabad and Chennai. This is the new center. It's coming up in, Hyderabad. This is a new version. We are starting it in next month. And we are within 6 months, we are starting in Dubai. This is a JLT Mazaya. Not all this building is given to us. The ground floor, we are taking around 7,000 SFT. We might start it in a year to come. Thank you.
Thank you. Thank you, Sudhir. Excellent presentation and something to look forward.
Your voice is
So,
not coming.
Hello?
You're not audible.
He's audible,
Now?
sir. Yes. Can you hear me, Sudhir
Yeah,
sir?
I can hear you. I can
Yeah.
hear you. Can you hear
Okay.
me?
Yeah.
So first thing I understood, पैसा भगवान नहीं, पर भगवान से कम भी नहीं है.
You're not
So
audible.
So in what I understood, because the ortho is one of the most sought after branch because of the money they are getting. So once the people see the money in the pain branch, this branch will also grow in future. Because right now what is happening, the anesthetists, they are very much used to the instant money they are getting from the anesthesia, and they are not shifting to the pain management. So eventually, after looking at Sudhir and Kailash and everybody, and maybe the listeners here who will be doing the good marketing and good practice, so a lot of people will get involved in pain management, and our branch will grow eventually. So there are a lot of questions here. The one most important question I can see is, what is the legality about this marketing? Sudhir, that is question for you. Hello? Am I audible?
No, you are not audible.
Sudhir sir, we can hear each other. I think there is some device issue with you. You can't hear us. I think you need to. I'll talk to him on phone. I think he need to log out and re-log in.
Hello?
Hello, Sudhir sir.
Acha, leave and come back again. Yeah. So. Yeah.
Okay, so my question to Kailash sir is, like, many of us have pain clinics. We start, of course, with the pain clinics in the initial days. And then we have setups where we go and perform the procedures. So when we are planning to have hospitals, and of course, we have to start with some, basic funding and capital investment. So when you mentioned about investors or venture capitalists, what should be the take on their time of entry into the project as far as investment and equity is concerned?
So basically, when we are talking about venture capitalists or angel investors, so make sure that you are working and you are making this business successful. So especially in say single specialty clinic, it is your specialty. So
Right.
you whatever you are going to take investment, it should be a very minor equity to them. It should not be a large part of equity, because as you grow, this whatever is 10 lakhs or 1 crore today, it will grow into maybe 100 crore or maybe 500 crore if your business plan is good. So that time it will pinch you. So don't go very fast, but at the same time, take very calculated investment and try to be as low as possible. You don't take big one. But if somebody is coming to you and he want a large chunk, but he is also allowing you to grow very fast, like from one center, if he is allowing you to grow to maybe 20 centers, and is investing that much amount, he will take more. But from today, whatever is your worth, you are directly growing from 1 to 20. You are growing 20 times. So then you have to calculate that, and you may take for a more equity. So it all depends what is the offer and how much you want. Basically, when investor comes to you, they will ask you what is your requirement. So you should be very clear about what is your requirement. It is never what they offer. So
Right.
you say, I want to give you only 1% and I want maybe 5 crore. They have to see your business plan, your whatever is you're earning in your center, and then they will calculate whether it is worth or not.
Okay. And sir, for this kind of dealings, like, should we have a lawyer? Like, we are absolutely unaware of such
Yeah, of
facts
course,
and
of course.
dealings.
Yeah,
So
there's
yeah.
yeah, of course. The entire team is there. Lawyers are there. Accountants are there.
Right.
You cannot do it yourself.
Talk with the company secretary also. Sometimes.
Yeah, company secretary.
You have to have.
So Sudhir, we are very short of time. So Sudhir, one question coming constantly, that is, what is the legality of this marketing thing when you're doing marketing on social media?
Yeah. So legality, yes. We don't know actually what they say. Doctor's name should not be there. Okay, clinic name can be put, but right now we are putting the doctor's name, and also this with the proper what you call advice from the legal lawyers. They say everyone is doing this. Actual legality is you can publicize your clinic, not a doctor name. That's what they say. That's what the medical legal lawyers they say. But no, in the market, no, everyone is like promoting their doctors. The doctors are the face, basically, the corporate hospitals and also the clinics. So we've been doing it since almost 5 years. We never had any problem like putting a doctor's name and clinics, numbers and all. So legality, they say there is only clinic name should be there and not the doctor's name. So doctor should not be, what you call marketed. But
so if you see Uttam, what for this question, it is better to, if you have a clinic, it is better to promote the clinic, because see, problem may come anytime. It will not come today, maybe not tomorrow, maybe after 5 years, it may come. So legally in medically in medical field, the doctor's name should not be there. So you can write a clinic's name. And doctor's name only can be there when you are visiting maybe once. So you have a center in Chennai, suppose Sudhir, and you are visiting there. So you can write your clinic name and Dr. Sudhir Dara visiting during this time and this is days. So that kind of advertising can be done, but you cannot have only repeated advertisement for your own clinic with your doctor's name. Clinic can advertise, company can advertise, but not the doctor.
Yeah, one thing I understood, that you can form a LLP and you can, or either you can form a company. If you are not comfortable with the company, at least you form a LLP and then the LLP name you can market. That is what I have understood with the.
But in proprietary form, there is a problem. If you are proprietor,
the proprietor is a problem. So it should be the LLP or it should be the company.
See, LLP name is not a clinic's name, no. So LLP will be different. Like LLP, you can add your name, but it will be like a private company or LLP. That cannot be put as a, the
brand
address of your advertisement. So LLP is completely for the, administration kind of.
No, but your clinic name also can come. Like suppose Epion is a clinic name and XYZ is a LLP name. So you can in small you can write that LLP name, and big will be Epion.
But legally, clinical name can be there. So basically, the big title will be the clinical name only. Doctor will be, at the last of the advertisement, at the corner of the advertisement, you put doctor. You cannot put your face as the, 3/4 of the advertisement. The doctor's name should be a small.
And as you said, it should be the informative. You should not commit something. It should be informative thing.
In advertorial, it can be there. In advertorial, doctor's name, photo, everything can be there. Phone number, email ID, everything can be there. Not a standalone advertisement, which is 10 by 10 or
editorial kind of thing. No, it gives a good impression to the audience. Like, see, we have tried a lot of advertisements in Times of India. No call will come from Times of India. Because it doesn't have a credibility in Hyderabad, at least, because Times of India is highly circulated. So people, they like the orthopedician, they advertise, like knee replacement surgery, rupees 1,25,000. No one will get call. It's good for branding, but no, that's why advertorial is very important. Giving an information, okay, than putting it as a highly commercial. The commercial thing will not be a credible one. People will not like you. So you give some information. Finally, in the last paragraph, what you tell about your treatment, no, that will be good. Like, so people will regularly see your ads. Like, this guy is not a highly commercial guy, but at the end of this, it's commercial only. But only thing is, no, at least that part of things you should take care of.
So thank you both of you, because we have crossed our limit. We are now almost at 9:30 here, and almost 75 participants were there for this webinar. So it's a huge success, and you all register for our SSPCon 24, sorry, in Pune, so that you will have great such different kinds of lectures you will see in that conference. So you please register for that conference, and you're all
you should
welcome.
have a link here itself, so that immediately they can pay.
Yes, sir.
Dr. Nankar, namaskar. Dr. Nankar, namaskar.
I'll circulate it soon, sir. Okay, so on behalf of SSPP, yeah, I am concluding. Yeah, I'm giving vote of thanks now. Big vote of thanks to our speakers, Dr. Kailash Kothari and Dr. Sudhir Dara, for little, not so very commonly discussed topic, but the need of an hour. And they both have really put it across with elaborate presentation and very crisp description of it. And big thanks to our participants. We had almost 75 participants today live in the session. At the same time, we are going live on 5 platforms by Anaesthesia TV on SSPP's Facebook page, Anaesthesia Facebook page, and YouTube links. So thanks to Anaesthesia TV for taking us on 5 live platforms at the same time. And this meeting was not possible without the initiative of Dr. Uttam Sidhaye on behalf of Deenanath Mangeshkar Hospital. So thank you for providing us today's meeting and excellent topics with the esteemed speakers. And my all SSPP members, sir, SSPP members, for promoting this meeting and successfully marketing today's session with all across the globe. So thank you, everyone.
Thank you.
Thank you, sir. Thank you. Bye. Good night.
Good night.
Good night. Bye.